All right, welcome. Today, we're not just discussing oral lesions, we're stepping into a real time clinical decision. Two patients, two fungal infections, same broad category, but completely different consequences. One is routine, the other, a race against death. And today, you're the clinician making that call. No hints, no shortcuts, just clinical reasoning, and time is not on your side. The clock is ticking. Ready? Let's begin. So here's the plan. We'll solve case file number 1. Then we escalate to a true emergency in case file number 2. And finally, we'll put them head to head. So you never miss the distinction. Let's move to case file number 1. Focus here. Every detail matters because this one is a classic. If you know what to look for, you'll get it. A 50-year-old security guard walks in. His chief complaint? Severe oral discomfort. He looks frustrated, tired, even a bit defeated. He tells you, for the last 10 days, I've had these painful white patches. The pain? It's a constant burning sensation. Eating makes it worse, especially spicy food. In fact, it's now affecting his daily life. He's avoiding meals. Even brushing his teeth has become difficult. So you examine the patient, and immediately you see multiple white plaques on the palate and jaw, clearly visible. Now comes the moment that defines this case. You take a piece of gauze, gently scrape the lesion, and it comes off easily. But underneath, raw, red, slightly bleeding. That is not just a finding. That is a diagnostic signature. Now step back. Look at the patient, not just the lesion. His history: uncontrolled diabetes, hypertension, hepatitis C, and then a crucial detail. He had a similar episode 2 years ago after starting hepatitis C treatment. So now you're not just seeing a lesion, you're seeing a pattern: compromised immunity, recurrent infection, classic presentation. So, doctor, what is your diagnosis? Lock it in. It is a candidal infection. This is oral thrush, formerly known as pseudomembranous candidiasis, an opportunistic infection caused by Candida albicans, a fungus that normally lives in harmony with us until the balance shifts, and when immunity drops, it takes over. This case is textbook: scrapable white plaques, burning sensation, predisposing systemic disease, everything lines up. Now, management. Simple in principle, but must be systematic. 3 steps, 3 targets. First, eliminate the fungus: topical nystatin or systemic fluconazole. Second, correct the local environment. Improve oral hygiene by using medicated mouthwash and reducing the fungal load. And third, the most important step: fix the root cause. Because if you don't, this will come back. So you refer him. Strict glycemic control, because diabetes is the real driver here. And just like that, case 1 is done. Controlled, predictable, manageable. But now everything changes. Case file number 2, this is where every clinician gets tested. A 53-year-old man walks in, swelling on the left side of his face, pain, but then he says something that rings all the alarms in your head. I feel numb, loss of sensation. That is not just a symptom, that is nerve involvement. That is a red flag. Now you examine, and what you see is disturbing. A large black lesion on the left side of the palate. Not white, not superficial, black, necrotic. You try to assess it, but it does not scrape. It doesn't move. And then you notice exposed bone. This is not infection on the surface. This is destruction from within. Teeth in the area, loose. The odor, foul, overpowering. Now pause. Before you jump to conclusions, check the history. Diabetic since 15 years. And then the critical turning point: COVID-19 infection 1 month ago. Now connect everything. Diabetes, recent systemic compromise, reduced immunity. This is not coincidence. This is a setup, a perfect storm. So doctor, what's happening here? What is destroying this patient's face? This is mucormycosis or rhinoorbital cerebral mucormycosis, and this is an emergency. Understand the biology, because this is where it becomes dangerous. This is not surface fungal infection. This is not overgrowth. This is invasion, angioinvasion. This fungus is angioinvasive. It invades the blood vessels, forms clots, cuts off blood supply, and once tissue loses blood, it dies rapidly, relentlessly. That black lesion, necrosis, exposed bone, deep invasion, numbness, nerve damage. Everything fits perfectly. And confirmation, biopsy. Biopsy shows broad non-septate hyphae invading the vascular structures. Now, management. There's no conservative approach here. This is aggressive, immediate, and life-saving. First, surgical debridement. Everything necrotic must go. In this case, hemimaxillectomy. Half of the maxilla removed. Second, intravenous antifungals. Amphotericin B, high dose, no delay. And third, immediate reconstruction, stabilization of the patient, control diabetes, reverse immunosuppression. Because if you wait, this spreads to the orbit, to the brain, and mortality skyrockets. This is not treatment. This is intervention to save a life. Now let's bring both cases together, because this distinction is what defines a clinician. At first glance, they look similar, both diabetic, but the second case, it had COVID-19 trigger, a critical divergence point. Now the lesion. One, white, scrapable, superficial. Other, black, necrotic, non-scrapable, with exposed bone. One is an overgrowth, while the other is an invasion, and that difference changes everything. Candidiasis, non-emergency, managed with antifungals, routine care, while mucormycosis is a medical and surgical emergency. Immediate action is required. So here's your takeaway. Never diagnose in isolation. Never rely on a single sign, because diagnosis is a pattern recognition. Scrapable plaque plus uncontrolled diabetes is candidiasis. Black necrosis plus recent COVID is mucormycosis. These are both same category, both are fungal infections, but completely different realities. And that is the art of clinical diagnosis. Not just seeing, but interpreting. Not just identifying, but connecting. Because when you get that right, you don't just treat disease, you save lives. I hope this video helps you in making the right decision at the right time. Thank you for watching, and please do subscribe to Oral Medicine Simplified. I'm Dr. Suman Said Siddiqui.